Tooth pain with no dental problem? The TMJ, muscles, and nervous system may be the real cause. Have you ever been told your tooth looks fine, but it hurts anyways? You've had the x-ray, maybe a CT scan, maybe even a root canal, and yet the pain is still there. So today I want to answer a question I hear all the time. How can a tooth hurt when there's nothing wrong with the tooth? And the answer might surprise you, because in many cases, the tooth isn't the problem at all. In fact, I've seen many people lose perfectly healthy teeth and still have the pain, because the real issue was muscle, joint, or nervous system based, not dental. And thankfully, dentistry has changed a lot in the last 30 years. Let's talk about why tooth pain happens, how the jaw, muscles, nerves, and brain all fit together, and what actually helps. When most people say tooth pain, they imagine a cavity, an infection, a cracked tooth, or a nerve inside the tooth that's angry. And sometimes, yes, that is the cause. But clinically, tooth pain can also be referred pain, muscle-generated pain, joint-related pain, nerve irritation, or central sensitization. In other words, your brain may think the tooth is a problem, even when the tooth itself is innocent. 30 years ago, when I started my practice, dentistry didn't have the same understanding of myofascial pain and referred pain that we do now. If someone came in with severe tooth pain, no cavity, no infection, nothing obvious on x-ray, the thinking was often, well, if it hurts, the tooth must be the problem. So the teeth were sometimes extracted. And here's the part that still makes my stomach drop. The pain often stayed, because the pain was never coming from the tooth. It was coming from muscle trigger points, often in the jaw or the neck. The good news? That approach is now largely outdated. Modern dentists are far more cautious and collaborative than they used to be. So if it's not the tooth, what is causing the pain? Let's start with the muscles. This is one of the most common and most overlooked causes of tooth pain. Key muscles involved are the masseter, the big chewing muscle on the side of your jaw. Trigger points here can feel like upper or lower molar pain, deep aching pressure, sensitivity to chewing. Temporalis, the fan-shaped muscle on the side of your head, trigger points can refer pain into the upper teeth, the temple, and behind the eye. The medial pterygoid, deep internal jaw muscle, can create deep tooth pain, throat discomfort, a feeling that something is wrong inside. And here's the important part. Trigger point pain doesn't stay where the muscle is. It travels. Your brain interprets it as a tooth pain. Think of it like bad wiring in a house. The problem is in the wall, but the light flickers in the kitchen. The light isn't broken, the wiring is. I teach manual therapists, like massage therapists, chiropractors, and physiotherapists, how to assess and treat temporomandibular joint disorders in my Simply TMJ webinar. The link is in the description. Almost all tooth, jaw, and facial sensations run through one major nerve, the trigeminal nerve. It supplies teeth, jaw joints, facial muscles, sinuses, parts of the neck. So when muscles, joints, or soft tissues become irritated, the trigeminal nerve doesn't always tell your brain exactly where the problem is. It just says, something hurts here, and your brain fills in the blank with, it must be my tooth. But sometimes the nerve itself becomes part of the problem. Chronic clenching, grinding, poor sleep, stress, and neck tension. All of these can irritate nerve tissue. Lower pain thresholds make sensations feel sharper, louder, and more threatening. This is where we may start to see central sensitization. Here's a simple explanation of central sensitization. First of all, this doesn't mean it's all in your head. It means the volume knob on your nervous system has been turned up. So mild pressure feels painful. Normal chewing feels alarming. Tooth sensations feel exaggerated. The nervous system becomes protective, sometimes overly so. And unless this is addressed, dental work alone often doesn't resolve the pain. Medications can absolutely play a role, depending on the case. Anti-inflammatories, muscle relaxants, and neuropathic pain meds can offer short-term pain relief. But here's the limitation. Medications don't resolve trigger points. They don't retrain movement. They don't calm a sensitized nervous system long term. They can be part of the plan, but rarely the entire solution. This is where modern care really shines. Dentists rule out true dental pathology, identify bite stresses, parafunction, which means non-normal and excessive use, and wear patterns. They provide splints when appropriate, refer when pain doesn't match dental findings. Medical doctors rule out systemic or neurological conditions, manage medications when needed, investigate red flags. Manual therapists, including massage therapists, physiotherapists, and osteopaths, assess jaw, neck, and facial muscles, treat trigger points and soft tissue restrictions, improve movement and joint mechanics, and calm the nervous system. When these professions work together, patients finally get answers instead of more procedures. So if you have tooth pain and nothing shows up on imaging and dental work hasn't helped, it doesn't mean you're broken. It doesn't mean it's imaginary. It means we are looking in the wrong place. Muscles refer pain. Nerves amplify signals. The jaw doesn't work in isolation, and the solution is often education, assessment, and collaboration, not extraction. Your brain and nervous system are so important. If it's your upper teeth that are hurting, here's a video on treating your temporalis muscle. And if you want to understand your jaw better, start small, stay curious, and remember, pain is information, not a verdict. If this resonates with you, or if you've been told everything looks fine, but you still hurt, you're not alone. And there are options. If you found this helpful, let me know in the comments. I read them and they help me guide future videos.